Hello and welcome to Shhh, the talk show, where we talk about taboos and change minds one conversation at a time. If you enjoy our episodes and believe in what we're trying to do, please click the subscribe button because it helps us reach more people. We encourage you to please follow us on Facebook, Instagram, Twitter, and we also have our own blog page where you can actually share your personal story and help someone else. It's called shhthetalkshow.wordpress.com. Please watch the ads that roll before and after this episode because it helps us make a little much needed money off YouTube. And we also welcome any donations and sponsorships that will help us run this project, which is very much a voluntary exercise. Thank you for joining us and enjoy the episode. So I want to start by saying today's conversation might be a little sensitive for some of our viewers, and if you are someone who has experienced some of the things that we're talking about, and if you feel like this is going to trigger you emotionally, please, I'm asking for viewer discretion. Feel free to watch the show only when you're comfortable, to watch the show with a supportive partner or a family member, or please feel free to not watch the show as well, because we care about your mental wellness more than we care about, talking about these things. I want to thank Tricia and her concept store Thoughts. This is an interior decor concept showroom that we're using this season. It helps us as a show to not have to look for spaces to shoot our episodes in. We've been lucky in having great locations that have allowed us to shoot in, but Tricia came forward and allowed us to use her space. And if you come to Thoughts, it's actually quite an intriguing concept space. There are different little corners of this building that have some amazing furniture and little interior decor ideas, and it's so beautiful and elegant. So if you're looking at refurbishing your house, or if you're into the business of property development, hotel interiors, please come across to Havelock Road, look for Thoughts, and check out the space, check out the ideas that she has for you. So thank you to Thoughts for letting us use this location for the show. Okay, so today is a conversation that I'm having for the first time about a subject that I have not been familiar with, nor have I heard about until one of our guests actually reached out to me about it. And that is the topic of obstetric violence. I'm not a mother. I've never been pregnant. I've never been in a labor room. So it's never been something that I've considered in my life. But I hear that this subject of obstetric violence seems to be more common than anyone knew. It is a form of gender-based violence that goes undiscovered, unspoken about, and it seems to be, from what I'm reading and what I'm hearing when researching for this show, a very, very pervasive and worrying issue in Sri Lanka and around the world, but most predominantly in Sri Lanka. And I'm very grateful for two wonderful women who are being vocal about it out there. There's Kanya and Ameena, who have joined the show. Thank you very much for coming on board to talk about it. And both of these ladies have been sort of doing their little bit of activism around this. I think Kanya has her own podcast, and I started listening to it recently, the Dark Light podcast, which was amazing. I think you should check that one out. And Ameena also is on social media spaces talking about it. So I'm not the expert here today. I don't have a lived experience on this subject, so I'm going to leave it all to you. What is obstetric violence exactly?
I think Kanya, you would be perfect to take this.
I didn't know what it was either. I came out of my birth experience just feeling really bad about a lot of things that happened, just really sad, unable to kind of get over it, and having these flashbacks towards my birth. I couldn't actually even really be in the same room as my son initially, because it was just bringing back experiences of the birth. So when I was left alone in a room with him, it was quite difficult to process what had happened. And so I started researching about it and realizing that I was showing symptoms of birth trauma, which
so this
is
is not postpartum depression.
I didn't know what it was. It could have been some element of that, but I wasn't depressed. It was more that I was fixated on the birth and what had happened during the birth, specifically interactions with certain care providers and support staff in the hospital that felt really wrong to me. I wouldn't have used the word violence at that time because everybody was, as far as I could tell, just doing their job. But really negative experiences with a lot of people that I encountered through my labor and delivery. And as I started researching, I came across this term, obstetric violence. And it occurs when a person encounters pain, fear, humiliation, intimidation, coercion, disrespect at the hands of a care provider during pregnancy, labor, or postpartum. And when I started looking into it deeper, I realized that, okay, there are the more sort of obvious forms of violence, right? Like being hit during labor, being shouted at by your care provider. But there are also things like not being given informed consent about medical procedures that are being done on your body, being coerced into certain procedures that you didn't think were going to happen. Having, just to give a kind of personal anecdote of what felt really bad for me during my labor, there was a ward doctor who came into the room and my labor had been induced. So I was, I don't know if you know what that means. There was a procedure that was done to speed up my labor because my doctor was leaving the country. So, that procedure was about to start. My obstetrician was not there. And this male ward doctor walks in and he sort of is prepping me for this internal vaginal exam, a cervical check. And I really didn't want that because my obstetrician had just done that, explained to me what was going to happen. And my husband and I were like, look, we don't want you anywhere in there, and this guy just sort of completely ignored what I said. And he performed this vaginal exam on me really forcefully. And
Was your husband there?
yes, but we, and that's the problem with a hospital setting, right? Is that when you go in, you're expected to sort of submit to anything that they
And you're
do.
also being in labor, whatever, you're vulnerable at that point, right?
Yeah.
You're just going with what everybody tells you to do.
That's right. And so we're there and this man walks in and he tells us he's a ward doctor and he performs this vaginal exam. And it just felt really a violation for both me and my husband because in the days leading up to that, I was very close to my due date. We'd been so careful, like yoga and just really relaxing and taking it easy and being easy on my body. And even if we were to be intimate with each other, we would be so kind of gentle and careful. And then this guy comes in. And for some reason, both of us, we just held hands when that happened. It was very quick and he left. And we didn't even speak about it until later. But we both knew that was not right, what happened. And I guess that was one of the reasons that made me understand what this obstetric violence is, right? So the World Health Organization says that it is one of the most prevalent, but one of the most underreported forms of gender-based violence. And I believe now, having gone through that process in a hospital, that the reason for that is because of the medicalization of birth in the last couple of generations. Really rapid shift from birth being a very natural physical process to being a pathologized situation in which I was referred to as a patient all throughout my maternity care. And I was not sick. I was just pregnant. I was going to have a baby. Yeah. And when you shift birth from the hospital, from the home setting into the hospital, you turn laboring women into patients. So obstetricians are trained to say, look, we just need to get this baby out of you, the same way that you would take out an offending appendix.
Yeah, and damn your experience.
And not even your experience, you're just a vessel. You're not expected to participate in that process. For an obstetrician, the best thing is for you, the patient, to lie on their back, preferably quietly, right? But for the woman, you're suddenly faced with these really primal urges that come to you in labor for a reason. They're preparing your body for labor to move around, to make noise, to do all those things that your body needs to, kind of birth this baby. And by definition, that puts you in conflict with the people around you. It's not that they're trying to, hurt you or harm you. It's just that their job is, let's get the baby out. She's in the way.
But she's a human being.
Yes.
She's a human being with natural...
Absolutely.
Yeah. What she was saying was when I had my baby, I came out of the experience and I was like, I didn't feel happy or amazed that I had a baby. I felt like, what the hell just happened to me? Like, it's just really weird that you just feel like.
Were you conscious of what was happening when it happened, or is it like a reflection afterwards where you're like thinking back and?
It's more like, so my story is a little bit different when it comes to Kanya's, in that for me, when I was pregnant, I had a perfectly healthy pregnancy. Like nothing was wrong. Like, it was perfectly healthy. Everything was fine. And I was just under the impression, but when you're perfectly healthy, you just think, okay, I'm just going to have a normal not being the right word, vaginal delivery. Now there's no reason to have a surgery or have any procedures done. I'm healthy. I'm young. This is my first baby. I just kind of thought that everything is fine. I'm going to just have a reasonably okay delivery. And I thought my doctor was on board with that. And I kind of expressed that these are the things that I would like to attempt to do in my delivery. Like, I'd like to just have the baby naturally. I'd like to be at home as much as I can and labor. I just didn't see the need for any medical intervention because there didn't seem to be anything wrong. So I had the idea that when you're unhealthy, only you need medical help, right? I'm a perfectly healthy pregnant person. What's there to, have a fuss about? So I was operating under that impression. And I thought my doctor was on the same page. And then closer to my due date, we have frequent appointments now. We're close to delivering. Closer to my due date, I am not in labor. I'm perfectly fine. I just come in for an appointment. I have a checkup. So she does a vaginal exam, and my doctor gets super excited. She's like, oh, you're already like effaced, you're dilated a little bit. For that means, like, basically you look like you're just about to go into labor. Yeah. Like, all the signs are there for you to go into labor. Literally, she's saying that possibly the next day or that night itself, I'll go into labor. So she's like, just come in. If you're not in labor, you just come in on Saturday morning. I'll give you like a chit and, you get yourself admitted. But, it looks like all systems are go. So I was just like, oh, okay, baby is coming. Like a naive first-time pregnant person. This show is on the road. So then the next day it comes. Nothing happens, And the day after that, nothing's happening. Like, I'm just fine. There's no signs of labor. I'm just perfectly being a, pregnant woman going on with my days. And I was like, okay, maybe I'll just come in on Saturday because she did tell me to come in. Maybe I'll just come in and just have a checkup and see what's happening. Then I go in and I realize, oh, that's not what's going to happen. I'm being set up to have an induction to jumpstart my labor and have my baby on that Saturday that my doctor wanted me to have it. So, so it was like a very eye-opening experience for me.
Why did your doctor want you to have a baby?
Exactly. So my doctor said that, after I come in and I realize that this is not just a checkup, this is me getting prepped and checked in to deliver, even though I haven't, started labor. Then only I have a couple of heated interactions with her, discussions with her, and she realizes that, oh no, it's not about me and when this baby is ready to come out, it's about what's going to work for my doctor. Yeah. So she's just like, oh, why wouldn't you want to get yourself checked in and deliver the baby on a Saturday when the hospital is fully staffed and I'm there and I'm available and it's
like I'm just convenient.
Little bit, yes. Yeah. In this case, yes. So they wanted to induce me, which is start me into labor because I was already so close to the tipping point of going into labor naturally. Why not? Yeah, just push a little and get this baby out. Everything is set up here. Hospital's ready. I'm ready. But I'm not, the pregnant person who has to do the part of, removing the baby is not ready because I'm just under the impression that labor will start when labor starts. I'm perfectly healthy. Why do I need to have medical intervention? So that was for me a first sort of.
It's like a coercion of some
little bit, yeah. So this is where when you talk about obstetric violence, this is where it gets a little bit in a grey area. Well, you just think that, oh, this is just me listening to the doctor, when actually it's not. You're being subtly manipulated. You're being subtly coerced. And sometimes just outright bullied into doing things, and we're not being told why, or you're not giving an explanation, and you're not even discussing risk or benefit. You're just Saturday is the day you're going to give birth because it's convenient for me. So for me, what happened was I got stubborn and I was like, no. I had done a bit of birth preparation beforehand, and I had learned that when you start things off in a bit of a with a bit of medical intervention right up front, you set yourself up for a cascade of things to happen. And I was perfectly healthy. So I was sort of like got into a discussion with her, with my doctor, said, look, I don't want to, because I really don't understand why I need to do this other than your convenience, And so we got into a bit of a tense standoff, and then my doctor also back off.
You don't want to get into tense situations with the person who's going to be assisting your labor.
Well, that's why I agreed to the induction. That's why it's interesting that both of our stories start with this induction thing, right? And it's so eye-opening. I think this has been for both of us about the Sri Lankan maternal healthcare system. Personally, for me, I lived in the States for 13 years. I was in the States when I got pregnant. I chose to come back to Sri Lanka to have my baby here. My husband's an American. And I'm very privileged. I would have had my choice of healthcare facility there, any kind of birth I wanted. But I had read so much about the Sri Lankan maternal healthcare system being this sort of shining example for Asia. And it is, right? I have to say that right off the bat. We've talked about this all the time. It is. We have just great numbers, but we're getting women through childbirth, at a much higher and healthier rate than like all of our neighbors.
The United States, for example.
Yeah.
We have better rates than a developed country of the United States. So obviously we're doing something right.
We are. Yeah. So I came back for that reason. But then I started to understand that we have sort of lost something in this transition to a very sort of safe, medicalized form of obstetrics and maternal healthcare, which is that we've sort of left behind what any of this might mean for the mother. So things like C-sections are on the rise. The Family Health Bureau says that we have like a 40% C-section rate. That's the World Health Organization says we should be at 15. Things like induction has become such a common practice. And I actually felt so sorry for my doctor, because she had to go abroad and she was trying to find me a replacement who would be respectful of my wishes in the same way that she was, who would support me through a vaginal delivery, who would let me kind of labor undisturbed, unmedicated. The day before she leaves, she's found replacements for all her other patients, high-risk pregnancies, right? People who need specialized fetal medical experts. Couldn't find one for me because I wanted to have a freaking natural birth. And I really felt for her, because she is sort of a lone voice in this, like in that moment, I just sort of understood the pressures that obstetricians are also under. But that doesn't make it any easier for the laboring person. We're sort of all brushing up against this really big dichotomy between what a laboring woman needs and what the system is set up to do, which is to treat it as a very kind of run-of-the-mill process that just needs to, it's a sort of a get in and get out. So there's no compassionate care, is what I would say.
That's curious, right? And I know when I listened to your podcasters, I realized a lot of things. I didn't know about any of this until I listened to it, honestly.
Okay.
And I know you wrote to me and you said, why don't we talk about this issue, which I'm very grateful for, because I didn't realize just how bad it is. So one thing that both of you talked about was the privilege of having, you have your support system in your partners, you had the education around this subject, you had looked into all of this, what you wanted and what you needed, then you have had these conversations, for instance, with your doctors beforehand. But then that's not the case for the majority of women in Sri Lanka, right?
Exactly.
And something that I realized was that there is a marked difference between the privileged ladies' experience in the hospital, where certain medical fraternities can be held accountable, even if if you're aware that something has happened to you and you're not comfortable with something that happened, you can even take it up. But then what about the women from lesser privileged groups, the disadvantaged, the lesser income groups and all that? I was actually listening to that story of Jiva on your podcast.
Jessie?
Was it Jessie?
Jessie.
Okay,
Yeah.
Jessie, sorry. And the was it Jessie whose story had said like the nurse had kind of shoved her legs apart and tried to force the hand in, and when she had said no, the nurse had said like, you
do this when you're having sex with your husband, so why can't you do it now? Yeah.
So I mean, I would call that violence. I would call that abusive. I would call that completely uncalled for. But
Yeah.
then when you have a woman who is not able to fight back in that sense.
Yeah.
in
You know
a
what's
situation.
actually quite interesting? You're talking about like privileges of us being able to go to private healthcare versus, those who have to go to government hospitals. You did a podcast episode where you compared somebody who went to government hospital,
Can you tell
and
me
you
some
had
stories?
you compared how you were paying to get the same treatment and same treatment that person got. So there's privileges and all. There are definitely privileges that we have, but ultimately somehow there's similarities in this treatment that we're getting.
It's true.
We're just paying a higher bill.
But where it changes is the privilege of knowing that something is wrong, and that not having that enough awareness to even think this is wrong, right? I mean, a lot of people in this system would say, that's the way things are.
Yeah.
Even if you get hammered by your husband at home, that's the way.
Yeah, that's
we
true.
don't question it.
Right.
And that was where I was coming
Right.
from that the fact that you would be in a position to know better. But then so many women out there can be mishandled, abused, and used, and they wouldn't even know.
Yeah, I mean, there's very little research done on this, right? I think we've found just one study. It was published in 2018, and it was also all in Colombo. So 10 antenatal clinics in Colombo, and they actually interviewed the public health midwives as well as the laboring people. And all who were interviewed agreed that this happens, right? Including the healthcare workers themselves, the midwives. And it was clear from this study that, yes, it is people who are of a low socioeconomic class. Language is a huge issue when you don't speak Sinhala, when you're a Tamil speaker. So this podcast episode that you're referring to, this woman was giving birth on a tea plantation. She was from that community, Navalapitiya. So, she faced sort of like just ticked all the boxes for what, got physically manhandled, got yelled at, got talked down to for not being able to speak Sinhala, got laughed at, mocked while giving labor, all of that, right? But then at the same time, when I spoke to this other lady who opted to give birth in the public sector, right? So also enjoys similar privileges to me and Ameena, in the sense that is, English speaking and all of that. All of what she communicated to the staff was ignored, including a physical condition that she had that necessitated her to lie on her side in the fetal position, which is actually how many women choose to labor. But because she was in this government hospital, for them, you lie on your back. That is what you do. You don't come in here with all these newfangled, let alone getting on your hands and knees, which again is a position a lot of women choose to assume.
That's supposed to be a natural position.
Yeah, just anything you read, anything you watch, that's sort of, but she wasn't allowed to do that. She had to lay on her back, and I think it damaged her physically because she had this hip condition. So she would have had to be in that fetal position, but the nurses basically kept her on her back, which meant that she needed a forceps delivery because she couldn't sort of rotate her hips in the way that was necessary. So, all of this to say that it is somewhere where privilege actually kind of is equalized a little bit in this situation.
We're
because
all vulnerable wherever we are when we're giving birth, and it doesn't really matter what status and all that. You're all the same person when you're in that pain and you're in labor. So that's all really there.
After your deliveries, did you realize
that's what actually I wanted to tell you is the thing is we're both privileged, we're both educated, but then still it took some time, right, after we had our children to realize that something was wrong. There's an instinctual feeling that something is off. Why did this happen? I'm not comfortable with it. Something weird happened to me. That's literally how I felt. And then only later, later only you find the words to kind of label what it is you're feeling in your gut. So it's what you're saying is that you really have no idea about this until it happens to you. And that's one of the reasons why we're here. It's why should people wait until this happens to them to realize that this is wrong? Even for us as educated and as much a preparation as we did, we still came out of this experience not being able to put words into articulate what has happened. It takes us having to research about it, having to speak to other people, actually having to put in some effort to find out what exactly has happened to us. And I wouldn't even say that what has happened, and I don't want to minimize my experience because what happened to me was traumatic. But I wouldn't even say it's as bad as what's happening to other people in other locations, right? But that doesn't mean that just because, what's happening to us is less than or, should be, treated with less respect than someone who's saying, getting physically assaulted, sexually assaulted, cut open, all those, hit, all those things. They're really bad. But what's happening to us as well, in my case, what's happened to me is that very pervasive coercion, that manipulation, that bullying is still as bad.
Yeah.
And there's a spectrum when it comes to obstetric violence, and like you have to sort of acknowledge that there's a range of abuse that's happening, and all of it is valid, and all of it needs to be called out, and all of it needs awareness. Because just because when you hear obstetric violence, like what do you think is the woman in government hospital who's having, the tissue torn apart, that kind of very visceral, very horrific kind of an idea. That's what you think. But actually, it can start as simply as like what Kanya was saying, in your prenatal care, being referred to as the patient, being forced to comply and listen to what the doctor is saying, not
being able to ask questions.
Those things.
Consent.
Exactly.
Not being able to consent. Another thing that on your podcast, one of the stories where that cut,
the episiotomy, yeah. Episiotomy.
The cut.
Right?
Yes. Somebody cutting into your vagina. That it should happen with the woman's consent. That she should be informed that it's going to happen, not that suddenly out of the blues in the middle of labor somebody comes and cuts her out. It just sounded horrific.
And in fact, it's so interesting that you said that, because when we talk about the rights of laboring people, even people that I have spoken to have kind of brushed that aside as this sort of Western notion. It's like, and here, just wait. But in fact, these guidelines are codified by the Sri Lankan College of Obstetricians and Gynecologists. They have best practice guidelines for this that talk about informed consent, that talk about compassionate care. There are wonderful obstetricians working in this space that have actually sat down and done the work of that. But we wouldn't know it. Now, and especially when you're in labor, you're not going to kind of checking off, what are my rights and what are not my rights. But we do have those. We possess them here. It's written. And I think that's what's really sad about.
A lot of women don't know.
They have no idea. And when you do know, are you in a position to advocate for yourself? I mean, you talk about taboos on this show. That's what it is. And I think the reason why it's really hard to talk about this is because birth is such a sacred thing that when you come out of it with a living child, people really just expect you to be grateful.
Yeah.
And people very close to me have told me, when I was talking about this in those early days, trying to kind of muddle my way through it and breaking down every day, they were like, what are you doing? You're being so ungrateful. You've got this child. And I'm like, but what happened to me? Like, I walked into that hospital really at the peak of health.
This attitude of, right, so it's over.
Yeah, exactly. Brush it under the carpet.
And more than I think any other form of abuse. Okay, I don't want to use that word abuse, because again, I did, it's a very gray area, my story. But that feeling, Ameena said when she came out of her birth, I felt like I'd been in a car crash. And I felt exactly that. I mean, is that the way you're supposed to feel? That you've just been kind of ravaged, like at the end of it, I had forceps, vacuum extractors, episiotomies. Like, I just really felt like a rag doll that had been just run over by something.
And do you have any medical condition that required any of those?
Zero. I mean, I had gestational diabetes, which is actually very common among Sri Lankan women, which is, when you have high blood sugar just for the duration of the gestation. But I was managing that like completely with my diet, but they do consider that a kind of a tricky situation, so just to be fair, I had been diagnosed with that. But as far as I'm concerned, that didn't necessitate any of what was done to me. And it's because of this cascade. I think maybe, you're better to talk about the way we talk about this thing called a cascade of intervention. So when you start with a certain medical procedure, the chances of you needing more of those are more and more likely.
How does that work?
So a cascade of interventions is basically how things snowball. Like the little decisions that you make in the beginning, like agreeing to, come to the hospital and get induced. The doctor, or not the doctor, but the hospital policy not allowing you to eat or drink during labor.
Oh yeah.
Things like you're not allowed, you have to have an enema, and flush out your system before you give birth. You can't labor comfortably in your clothes. You have to put the hospital down. These little things, you think that they're not big deals. But in the grand scheme of things, they all snowball and lead into, they affect the final outcome of how you deliver. And you should know that. That's so important, because you don't think these are little things, but these are actually you kind of giving your rights away a little bit.
When you say they affect the outcome in a good way or a bad way?
Well, it depends on what you want out of birth. So for me, who wanted to just have a low intervention, like vaginal delivery, that really had a big effect because I ended up with an emergency C-section. For someone else who's just like, no, I just want to have this baby come out. I don't really mind how it comes out.
Yeah, right.
Then it may be, it might not have that kind of an effect to them. So it really depends on the person, I think.
I mean, so I'll give you an example, right? So now for myself, being induced, when your labor is induced, it's bringing on very strong sort of artificial contractions, which the baby is not expecting, right? Because it's not the natural physiological process. So as a result, you have to have this thing called constant fetal monitoring. So you're strapped to the bed with this thing to check the fetal heart rate because they don't want the baby to be too shocked by these, sort of uterine contractions.
Drugs as well, right?
When you're strapped to the bed, you can't do what you're called to do naturally in labor, which is to move around. So, moving around during labor, it regulates your blood, it regulates your heart rate, it kind of keeps you in that fighting fit condition to get to the pushing stage and actually deliver the baby. So then you're confined to this bed. Then there's a greater chance that you can't bear the pain because movement helps you to bear labor pain. And when you're in the bed, the pain becomes sort of unbearable. So then I never wanted an epidural, but I asked for an epidural. My labor was 24 hours. 12 hours in, I couldn't anymore just lie in that bed. There was no relief. So I asked for an epidural. When you ask for an epidural, the chances of you having to be catheterized are higher because you can't feel really what's going on. And when you're catheterized, the chances of you like just lying there and not being able to push the baby out without assistance are higher, which is why I ended up with forceps and a vacuum extractor, which I mean, if you see those things, you just can't imagine that child, I mean, his head was like, I can't even talk about it really because I still don't know what impacts this child is going to have. And that was part of the birth trauma also, right? Like looking back on these things that happen that you never wanted and then playing it back step by step. How did this start? How did I get here?
Kind of like a horror movie. Just
also,
keep going back and watching it.
When you say that, okay, now Sri Lanka has this culture of not allowing family members into the labor room, right? And it's very few hospitals that allow that at all, and that's also very recent. So when you don't have anybody supportive from your side in that room, you're surrounded and at the mercy of whatever people are making you do there.
And that's why we are like begging for compassionate obstetric care, especially among the support staff, right? Now, the nurses who were on duty for me, I mean, it was indifference. They were not hostile, but indifference to the point of negligence can feel so bad in that moment when you just need someone to maybe hold your hand.
And I've heard, I mean, before obstetric violence became a topic that I was looking into, I mean, so many of my friends and women who have sort of had the labor experience and all have talked about the nurses shouting at them.
It's almost like a rite of passage. I think everybody gets shouted at by a nurse.
Not so much the obstetrician or the doctors in the room, but it's the stories that I continuously hear are the nurses being very aggressive.
And in fact, there was one nurse who was really nice to me. But now, 24 hours of labor, right? This poor woman has to go off shift.
Yes.
And she had the decency to come and tell me that she was going off shift. And I was so pathetic. I grabbed onto her. In that moment, like she looked like my mother. I was like, okay, this is my mother. I need her here. I was like, please don't go. And she was like, Ane, darling, I have to go. This other nurse is really, the other nurse was horrible, so mean. But you're in that situation. Like you never expect that you would be that vulnerable. I think the vulnerability, you can't plan for it. You can't anticipate
Exactly.
it. You're just like being hit by these waves of hormones and physiological, biological things that,
And from the stories now, because y'all are both advocating for this, you have spoken to other women about it, right? And you've kind of realized this is just beyond you.
Yeah.
It's actually quite prevalent everywhere. What are the worst stories you've heard? Or have you heard whether it's more men or women in the system who...
Like what's really interesting with Kanya is like her, like as being a journalist, like you want to hear other people's stories, right? For me, as a first-time pregnant person, I didn't want to hear anything because in my culture, they just love to scare pregnant women, especially first-time pregnant women. Everyone wants to tell their horror story, and in the guise of they're preparing you, they just want to come and tell you every horrifying thing that happened to you while you're pregnant. And I didn't want that. Like I wanted to be in that headspace where it's like, I can do it, I can do it. I'll prepare. If I study hard enough or do the hard work, everything will fall in place. I'm a good student that way. I wanted to protect my headspace. And then after everything happened, suddenly I needed to hear other people's stories. I wanted to hear what's happening because I felt like maybe if I had listened, this maybe I could have prevented from happening to me. So then you kind of become like this obsessed. You want to hear what the hell has happened. You want to hear like the stories, and you kind of craving for it. And then Kanya's podcast kind of delivers that really nicely. Like you have in a perfect audio format, you just hear the stories of what's happening to women, and then you're just like, okay, I'm not alone. But at the same time, you're like, wow, this is so much worse than I thought. Like what happened to me was pretty bad, but then it's actually so much worse. It's so much worse.
And in fact, to answer your question, right? I mean, I also don't want to fall into that trap of like delivering these horror stories because I don't want to frighten people.
It's not to frighten people, but it's to make people aware that this is how bad it is, and that's why it needs to be addressed.
That's right.
Exactly.
And I think so from interviewing women, and particularly the episode that you referred to, Jessie's episode, people didn't believe her because you see obstetrics and maternity care as this sort of gentle, kind, loving act.
Motherhood is the most beautiful sort of, or labor,
Yeah.
say, giving birth is the most beautiful experience.
So it's really jarring for people to hear this, right? And that's why I was surprised that she was actually willing to share in such detail. And, I mean, it's everything that you could imagine, right? From being physically harmed. I mean, okay, hit on. She was like, the doctor just gave me a small slap like this. I mean, okay, that doesn't sound like a big deal when you're in school and the teacher hits you. But when you're in freaking labor, I mean, that was pretty bad. Being manhandled, being dragged into that room, being sort of cursed at and shouted at. That even happened to you, right? I mean, so being mocked, so this particular woman, she had the presence of mind to really relax in between her contractions. So she was actually falling asleep in between, which is like the ideal blissful state that you can achieve, right? I would like train to do that. And these nurses and doctors on the ward are laughing at this, standing around her bed and laughing at her. I mean, she told this story with sort of a half smile, but also with like this shadow behind her eyes of like, wait, did that really happen? Did that really happen to me? And in the study that I cited earlier, which actually has some really nice, lengthy accounts that women give, of being scolded for soiling the bed in the middle of labor, of being, mocked for their poverty. Why didn't you bring this correct bed jacket, these clothes? And especially this thing about do not ask questions. The midwives themselves are like, po me prashna hana kattiya thamai karadareyak apita. So many questions. It's like, anyway, that's right. So that, to answer your question, like these are some of the ways in which, I mean, then there's also sexual sort of forms of sexual assault that take place in labor rooms, which are alluded to in the study. I don't want to, kind of speculate, but yeah, sort of lingering male nurses hanging around. Even what I described to you, what happened to me, this sort of unsolicited cervical check. I mean, what was that really? Why?
That's sexual abuse.
Yeah.
It's just done with someone in a white coat.
Yeah.
Considering the fact that there was no consent given, and you had specifically said you don't want it. It wasn't even about.
And her husband was in the room.
Said no, and it still happened.
And someone was there in the room, but still no regard for that other person, or that should I consider that the partner of this person is there and doesn't want this to happen. No sort of shame that I should do this in private. I'll just do, I'll just put my fingers in there and do. And like one thing, I mean, all this is very like technical, and I can understand that, maybe it put people off, like all these medical terms and things like that. But what's really at the core of obstetric violence is when you are in labor, right, and especially first time labor, you as much as you prepare, you can't really prepare for that kind of pain or whatever's happening. It's all new. And then you are in such a vulnerable position, and you're just looking for help and looking for support. And when someone kind of violates you or abuses you or makes you feel bad, I don't know, something about that kind of fuses with the memory. So even when I look back at my labor experience, I remember those fearful parts, the parts where I was feeling bad, or the parts where I was like crying to my husband, like, why are they shouting at me? Like, those parts get intertwined, and those things stay with you. Those things stay with you long after you give birth also. That it's really, really fascinating. But like, I don't remember much now. Things are obviously fading, but I remember those things. I remember the hurtful words. It's trauma.
Yeah,
It's trauma.
I think that's...
So to say that, it's just get over it. It's like, no, your body remembers, even if your brain kind of maybe
But
it
you
forgets
also
a while,
don't
you
know whether
remember.
it's okay to talk about it, right?
Yeah,
Because
exactly.
nobody else does.
Exactly.
So why do you think that is? Is it that because if it's happening so much, and whether it happens at whatever level of privilege it happens. Given that it's happening, why do you think women are not talking about it? Women who have gone through the experience, is it that they're not aware, or is it that they want to put it aside? Is it that they feel powerless taking on the medical system, that because it was just their word against everybody else in the room?
Honestly, like for me, I would say one is I wasn't even aware. Like I just felt something, like I wasn't happy with the interactions. I felt something was strange. So it took me time to kind of coalesce my thoughts to put a word to what I was feeling. And two is again scared of kind of backlash. And another thing is, when after everything happened, it's like, where do I go now? Like, where do I go now to report, or who do I go and like tell about this? Like, what's the system in place when something like this happens? And then when you're thinking about that, it's like, oh, should I actually? My doctor is, a well-known doctor in this hospital. Like, is it safe for me to go and, bring that up or talk about it, stir it up? But what will happen to me? What will happen to, other family members who go to her? Those little things kind of make it harder for you to go and talk about it, or file a formal report. And basically, it's just like not knowing.
With the research work that you have done, do you know if there's a process in which these things can be reported? If say a woman is aware that something has happened to her?
I mean, I don't know any recourse. And I think part of, just to also answer the question that you just posed, why are we not talking about it? I think it's because birth is such a physical experience, right? It involves the body in every way. So where do you draw the line between where a person is doing what is medically necessary to your body and where there's a violation occurring, right? Now you expect to come out of birth not to just jump up and start dancing, to be kind of a little bit battered by it. So that's what was really hard for me. I'm like, okay, I'm supposed to sort of be in recovery, but am I supposed to be in this much agony and pain and sorrow? No. So, I mean, I have the presence of mind to sort of work that out. But, there's a difference between having a natural tear in a vaginal birth and being, cut open with a scalpel, requiring 13 stitches. I think that's how many stitches I had. Those are two very different things. But there's such a thin line between them that you're sort of torn between wanting to thank the doctor for safely giving you this child and making sure that you didn't die, and being like, what happened? Why did you do that to me? So I think that's a really tricky place. And I think with, so someone like this woman who shared her story with me on the estate sector, who's going to sit and listen to that, to bear witness to that, to hear that conversation out in full, to tease apart those, those like very fine threads that separate one thing from the other. It's a medical procedure. And I realized when I started like looking into old Sri Lankan practices of birthing, midwifery, what existed a couple of generations ago, it was only then that I realized, look, we have everything here in this culture, in our medical practice. I mean, come on, we have like an ancient system of healthcare in this country. And the women who used to be the traditional birth attendants knew how to give that piece of it that we're keeping on saying has been lost, which is like compassion and kindness. And that sort of maternal, loving support. And it sounds sort of a little, I don't know, like hippie of me even to say loving, kind, but it is. Those are the things that you need.
When you're in a position of in labor, that's a very scary place to be. So
and there are some women who choose to elective C-section and they're done, and that's fine. I feel like those are the people who actually have the best birth outcomes. The women I know who are like, look, I don't want to go through this. I want the C-section on this date, and they're very happy with their experience. So I think our system is very good at doing that. But then for people like us who don't want that and are trying to kind of...
But there's also, I don't know if I'm right in saying this, but there's that unspoken, I guess, cultural thing within families and communities that if you don't have a natural birth, epidural free and all that, you're not really giving birth. Like you have to do it right kind of thing.
Yes.
Is that okay?
Yeah. That is there.
I don't think it's limited to just one community.
No,
I think that even in the rural areas and all that whole thing of, the correct way for the woman to give birth is to go through that whole experience.
Yeah, exactly.
Yeah,
It's
no,
like
I have
the-
heard that also, that people have spoken of, and even myself to a certain extent, I don't consider it a natural birth because of all these interventions that were done. I never really use that term anymore, natural birth versus,
It's almost
Unnatural
like
birth. What's
you're
the- what's
less
the
of a
opposite?
mother if you didn't go through that.
Exactly, and there's
Yeah.
some stigma also for those who choose to have elective C-sections, like, oh, you're taking the easy way out.
Yeah.
Well, we're after going through what we've gone through, like, actually, you know what, you're making a sane choice for you. If you choose to kind of bypass all these painful steps and just go and have your baby, it's not the easy way out. You're making a choice that's actually makes sense when you see what else you have to go through. But I think it's very interesting what Kanya said is, for those who want to have their children in a way that's, I wouldn't say not difficult, but it's easier for the practitioners. Obviously it's more expensive, it takes more resources, it takes time. Having a C-section is a major abdominal surgery, but if that is in alignment with your doctor, you will have maybe a better experience than someone like, say, us, who kind of wants to, as weird as it is to go against the system and labor in a way that's time consuming, that doesn't need a lot of fingers and hands and lots of involvement. We are kind of, I would say that we are the ones who are kind of problematic, I guess, in that birth system, because we want this way as opposed to this way, which is, you
But
could say,
let's
easier.
also talk about the options that we do have, the concept of a doula.
Yeah,
Right.
exactly.
So the concept of a doula, after you brought it up, I actually read up about it. The fact that you are entitled to have a labor companion in that room, somebody for the mother, and it's not part of the medical fraternity. That person is not a medical professional and can't intervene with that side, clinical side, but it's someone who's there for the comfort of the mother, to help her, and somebody who has sort of built a relationship with the mother, in that they help her with her breathing, they help her with her posture, her position.
And sometimes it's better when that person is not a family member, to be honest, because every time I looked at my husband's face or my mother's face, so my mother and my husband were like trading off, I felt so bad for them that I was like, Kanya, just don't say. They just looked so worried and stressed and sort of, didn't know what to do. So sometimes having an outsider who is just your advocate can be such a
friend, that comfort.
Yeah.
Because see, we're not also only talking about that process of giving birth, right? This affects your relationship with your child. I mean, I would say, I really hope my son isn't like 18 and watching reruns of this, but it took me like actually years to be happy in motherhood. I think it was like when he was turned 2, I remember thinking like, okay, now I feel that, what I'm supposed to feel. But before that, I couldn't look at him. I couldn't, when I was putting this baby book and everything together, it was just like, I was cringing having to look at pictures of him and me in the hospital, having to put on this pretense for people who came over. And then I would swing. I would like, sometimes when people would come, I would try to tell them all the gory details, and I could just see my cousins just clenching their whole bodies. And they're like, do we have to? Yeah, do we have to hear this, Kanya? Like one of my cousins got up and left. She was just like, I can't hear this. So, I think, but the ramifications are really big, right? Because you asked the question right in the beginning. You were like, Kanya, was it just postpartum depression? And I think that's how it would get diagnosed in a lot of cases. But some of the women who have come to me after 22 years of not processing this kind of, not necessarily obstetric violence, but birth trauma brought on by this clash of, labor versus hospital. They're like, maybe that's what it was all along. Maybe I just never came to terms with what happened to me in that labor room. And then when you can't bond with your child, I mean, okay, we can sit here and say that we've come past it. What if that is a lifelong thing? Is this the baby is taking everything from you. Every emotional cue that you put out in those first few months after birth, that the child is picking up on. My baby didn't make eye contact with me for the longest time. I thought that was another issue that, because then you think, okay, cognitive issues, they're not making eye contact. But maybe it's because I was putting out so much stress when I was in the presence of the baby. It's really, gosh, it's like...
So I just wonder why a doula is not used more, because it's allowed. It is allowed, but then I also read, when I did the research, I read a report where a lot of midwives didn't like the fact that there would be a doula in the room. The doctors had no issues with it, if a mother requests, if a woman requests that she wants a labor companion in the room, it's apparently it's not against any rules, and even though hospitals can say there's not enough room in the labor room for one more person, apparently in the Sri Lankan healthcare system, labor rooms can accommodate. So it's not a spacing issue, but apparently the midwives have been a little not so happy to have that person in the room.
So this is something that I kind of take a personal interest with, is that, so after everything has happened, so now I obviously got interested in birth education, but then I realized like so many of the problems are very intersectional, right? So then when you zoom out and look at it in a big picture, you kind of realize that there are some key things that are missing, that are lacking here, which is why women keep going through this healthcare system and getting the same level of abuse and treatment and then coming out of it, right? And one of the things is why we wanted to come on this show is, one, to bring awareness, and obviously to sort of tell people that, you know what, it's not hopeless, it's not hopeless. There are things you can do to protect yourself, there's, to an extent, there's some things you can do. One of those things being hiring a doula. Then we come to realize is actually you don't even get proper birth education to know what a doula is or how a doula can help you.
Know what a doula.
Exactly. You know what I mean? Exactly. So then you kind of come to realize that one is you're not getting the proper education that you need. Even when you go for your prenatal appointment, it's not like your doctor is bringing it up. It's like you have to willingly do the work. And you have not only that, but you have to not only have to ask for one, you got to probably find one yourself. You have to research about the benefits of them. You have to do all the work to have the experience that you want, because it's not compatible with the system here. And then even after everything that happened, I was just like, okay, you know what, I'm going to find all the resources that I would have wanted, when I was pregnant.
That you were lacking, yeah.
I was lacking. I want to know where I can get the proper birth education. I want to know where the doula is. Then you start looking for them and they're not here, or they're just starting up, or they're just like so underground, they're not publicly available like say in the other countries. And then you realize that we've got a long way to go before us as consumers of the medical healthcare system, I guess, because all of us, 98% of births in Sri Lanka have to go through the hospital. So it's going to take us some time to realize that we need all these things now to have the birth experience.
I think even this being taken up by activist groups, by mothers, just getting together, forming civilian, advocacy for it. It doesn't have to be like a rah, let's kill them all. It's not that at all. You're trying to make the experience better for yourselves, as well as for other women out there, as well as for the Sri Lankan system. Like you said, it can be such a shining example. Just going back to that concept of the doula, also I think that's a nice way to go, because we also have that history and tradition of, helping each other, the compassion, the kindness, everything. So it's not going against our culture. But something really interesting was that even though the policy to allow a labor companion has been sort of passed, ironically, a lot of private hospitals, the norm is apparently you allow a companion of the mother's mother's choice, as in your mother's choice, or male partner's choice.
Oh, right, okay.
And it's not
the laboring persons. Yeah, okay.
Which is funny.
Yeah,
it's ironic.
Yeah, because this thing about the doula, right? And just thinking about our culture, I'm glad you said that, because when COVID happened and people started having these sort of rushed funerals that were not in accordance with the rights of the religions, it was a big deal, right? Because we have a lot of death rights in this country and funeral rights, as in RITES rights, but also other rights. So, and it just really got me thinking, like, where are our birth rights? Why is it that, no person of any faith would stand for the undertaker being like, no, you can't grieve in this way, you can't come to the funeral in this way. No, like everything, the customs surrounding death are held so sacred. Like, I think we need to start thinking about what are our customs surrounding birth. Like, okay, it has to happen in a sterilized environment, fine. But then can we make some allowance for the sacredness of that, because it's the one thing that binds us. And if we respect death to that extent, that we will bury a person in the way that we see fit, dispose of a body in the way that the faith sees fit, how is it that we've let go of that completely when it comes to birth,
I want to read something from a little bit of research that I found, and I'm sorry to end on such a sort of a depressive note, but I think it's important that women's perceptions and experiences in childbirth are barely evaluated in Sri Lanka, despite relatively being having better maternal and neonatal statistics in the region. Every year, 25 to 30 women commit suicide during pregnancy or within 1 year after birth in Sri Lanka. Psychological morbidity amongst pregnant and postnatal mothers is an important area. So therefore, there is an urgent need to evaluate the quality of maternal care. So we might have all the clinical stuff in place, but let's think about what she's actually going through and talk it through and see what changes we